Let's broaden this out by discussing this with a General Practitioner and Clinical Director, Chapeltown Primary Care Network, Dr. Abiye Hector-Goma. Thank you so much for joining us on the news. Now, what more can we really understand about this rare disease, monkeypox?
Well, as we know, it's like the younger brother of smallpox, which was eradicated in 1980, and maybe the big brother of chickenpox. So it's actually a very rare disease, and it's no big deal. Let me put it that way. When you look at the number of cases that we've had worldwide and the number of cases we have currently, it's a rare infectious disease, but it's no big deal, really.
When you say it's not a big deal, this is something that a lot of people have been advised to wear face masks and all that. Is it that the kind of symptoms that you feel from monkeypox, though you said it's no big deal, how not so big deal is it? Talking about, vis-a-vis the symptoms.
Okay, I mean, the symptoms are not dissimilar to the symptoms of other viral infections. So you have the incubation period, which is the first 5 days where you have fever, and then you have intense headache, and then you may have generalized ache. Now, the enlargement of lymph nodes is common with monkeypox fever. You don't find it in chickenpox or measles. Then you have general being very tired. So the symptoms are quite non-specific, but when you get to the skin eruption phase, that's when you have the various rashes that come up on the face and mostly the extremities, which if you've seen chickenpox before, they're like teardrops, and these ones are much bigger than chickenpox rash, which may be 2-3 times bigger. Now, what I'm saying is no big deal is that when somebody has an infection of any sort, we wonder what the case fatality rate is, and that's the likelihood of somebody who has the infection dying as a proportion of all those who have had the infection, and the case fatality rate from 0% to about 10%. So it's quite gross when you see the monkeypox rash, but in terms of case fatality and the number of cases from the first time it was discovered in 1958 to date, the number of cases are not that many. So it's not spectacular when you compare it to others, really.
Well, the last time they've experienced this in the United States was in 2003, and they said a man from Lagos, took it to Atlanta, Georgia on the 9th of July. Do you not see this as a sort of a threat to some Nigerian citizens who will be, traveling from Lagos to the United States as a way of stigmatizing them in the way they might be scrutinized or checked, talking about the current situation of the pandemic as well?
Yes, I think it's important because when we look at the lessons from the COVID-19 virus and the efforts to change the name from Chinese or Indian or Brazilian or South African or Kent variants to different names, the Greek letters. So perhaps they need to do the same thing. But I just want to make an important point here that the very first case of monkeypox was found in captive monkeys that were being used for research. And I'm even thinking that I wouldn't say it's common to say it started in the rainforests of Central Africa, but I would say it was imported by researchers into the monkeys that were being used for research, maybe finding a vaccine for smallpox, and that was where the first infection was found in the monkeys that were being used. So if anything, monkeypox was imported to Central Africa, and then you have the so-called Central African and West African variants. But really, when you go back to the very beginning, there is no natural environment for monkeypox. It must have started from laboratory animals being used for research in parts of Africa.
Now that you've made us understand that it is quite zoonotic in nature, is it something that is contagious? Maybe when you relate with someone who has it, or does it have a latent phase that somebody might be a vector and then you won't know, and at the end of the day transmit it to anyone who come close in contact with such person?
Yes, like I mentioned, there's an incubation period of 0 to 5 days, which means that let's imagine that the 2 flights from Lagos to Dallas, or Lagos to Atlanta, and Atlanta to Dallas. If people were very close to our brother on those flights, if people refuse, for example, to wear a face mask and they sat next to him, then the likelihood of the droplets from the air coming out of his nose, if it has any droplets of the virus, the likelihood of being infected is increased. So similar to COVID-19 virus, similar to flu like we have here, it is transmitted first via contact. I mean, human-to-human transmission, thankfully, is rare. You're more likely to have animal-to-human transmission. So even though over 200 people from the 2 flights have been identified, from what one has read, there's really not much concern that they are going to be infected. It is said that the West African strain is less virulent, is less transmissible, less infectious than the one from Central Africa. So yes, the risks are there that anybody who was on that flight or who even had contacts with him while he was in Nigeria, we have to give kudos to the NCDC in Nigeria and the CDC in the US. And a lot of these organizations are more or less on their toes because of the experience of COVID-19, so that very quickly they're going to identify people and get them to be on isolation.
Well, thank you very kindly for giving us this insight into what it's monkeypox so far. Thank you so much. General Practitioner and Clinical Director, Chapeltown Primary Care Network, Dr. Abiye Hector-Goma. Thank you so much.
Thank you very much.